Okay, so what is cupping? So cupping is the use of these cups that can be made out of different materials. So there's rubber, there's plastic, and there's also glass. And so what they are utilized for is to help with restrictions in your tissue. So it can work on your fascia, which is tissue that runs in between structures such as your muscles. It can help lengthen your muscles, and it can also help with bringing blood flow to the area. So things that it's good for treating. So if you have some place that is inflamed or swollen, or you have what's called lymphedema, cupping can be good to help decrease the inflammation, that swelling, that lymphedema in that limb. What it's also good for is promoting healing process. So if you have tissues that is slowly healing, it'll bring blood to the area. Now, having blood come to the area is important because one, it brings oxygen and nutrients, but then it also helps clear out all of the debris, all of the histamines that kind of cause chronic inflammation. So it can be good for things that are like slow healing, but it can also work mechanically on tissues. So that means that it can change the length of the fascia. It can it can help with stiffness in tissues, and it can also help with tightness and stiffness and lengthening shortened muscles. So it can be good for, let's say, a lot of people have really tight calves and really tight hamstrings. So you can use a setup to help with lengthening that. But it also can do it has a neurological component too. So people that have a lot of chronic pain, it can help desensitize your system to that pain. So what it does is you can start putting the cups in an area that's not painful and really get your body used to feeling different sensations. Because with a lot of people with really high levels of chronic pain, their nervous systems are overly heightened. So what this does is helps to kind of calm your nervous system down. But it can also work on, it can also, with people that have just kind of chronic low level pain, like a lot of low back pain. So you can provide kind of a stimulus that's painful, and that'll help bring your naturally occurring opioids and enkephalins to the system to help relieve that pain. So these are just some of the reasons to use cupping, and it can be a good adjunct treatment to to things that you're already doing in PT.